Taking an aspirin a day to prevent having a heart attack might not be the solution for everyone. That is according to a new study from the Baylor College of Medicine.
CBS 2's Dr. Max Gomez here now to explain why. Doc?
That's right, Maurice and Christine. You know, aspirin is a blood thinner, which means blood clots form more slowly, and blood clots are the primary cause of heart attacks. That's why people at high risk for heart disease are told to take a baby aspirin a day. The downside is thinner blood also increases the risk of internal bleeding. 57-year-old Brian Hull has high cholesterol and a family history of heart disease. He takes low-dose aspirin every day to reduce his chances of having a heart attack.
The concern was that I not have a heart attack like my father did.
But a new study in the Journal of the American College of Cardiology finds more than 10% of patients taking aspirin to prevent a first-time heart attack or stroke should not be taking the drug. Dr. Ravi Duvey is a cardiologist at UCLA who says for some people, the risks of daily aspirin outweigh the benefits.
You can have a risk of having bleeding in your stomach. You can even have a certain type of stroke that can cause you to have bleeding inside your brain.
Researchers from Baylor College of Medicine in Houston looked at 68,000 patients and calculated each one's risk of developing heart disease over the next decade. It's based on factors such as age, sex, blood pressure, and cholesterol. Researchers found patients whose risk is considered low should not take aspirin.
You need to check with your doctor to see if you need to continue taking the aspirin.
The study found that based on those risk factors, 17% of women were taking aspirin unnecessarily compared to 5% of men. But that's for what doctors call primary prevention, meaning for people who've never had a heart problem. Patients who have had a heart problem should almost always be on aspirin. Brian Hull believes using aspirin over the past 10 years has prevented him from having a heart attack.
Knock on wood, I haven't had one yet, and I'm hoping I won't have one forever.
However, this study did not take into account the evidence that aspirin can reduce the risk for a number of cancers by as much as a third. So some experts say that factoring in the cancer risk reduction may actually tilt the scales towards taking aspirin, even for those at low heart disease risk. Christine?
All right, Dr. Max, thank you.